maternal mortality rate here was about 8,000 per 100,000. I mean, then you could have as many as 30 women dying in a month in this hospital.
Today, we are joined by a distinguished guest, Dr. Femi Omololu, the Chief Medical Doctor at Lagos Island Maternity Clinic. Dr. Omololu is a highly accomplished obstetrician and gynecologist with extensive expertise in leadership, medical education, and strategic planning. We are thrilled to have him here to share his invaluable insights into the evolving landscape of maternal and women's healthcare in the country. Please join me in giving a warm welcome to Dr. Femi Omololu.
Welcome to African Health Echoes, where we talk about healthcare leadership, innovation, and tell real-life stories about the healthcare landscape in Africa. With me today, I have the wonderful Chief Executive Officer of the Island Maternity Hospital here in Lagos, Dr. Femi Omololu. Thank you so much for joining us, sir.
Good afternoon. Thank you.
Yes,
nice
sir.
to meet you. Yeah.
So, Dr. Omololu is a highly experienced obstetrician and gynecologist with expertise in leadership, medical education, and strategic planning. As a fellow of the West African College of Surgeons, Dr. Omololu has made incredible strides in advancing maternal health care in Nigeria. We're excited to have him share his insights on the evolving landscape of maternal and women's healthcare in Nigeria. So please welcome with me Dr. Femi Omololu to the show. Dr. Omololu, we're so excited to talk to you today, and we know that you've walked quite a long journey to get to where you are today. So can you start by telling us more about your journey in O&G and how you've become the leader in this beautiful hospital and organization?
Probably have to wait for my biography for that. I've always wanted to be a doctor. I'm a third generation doctor. My grandfather was a doctor. My dad was a doctor. So I guess I always wanted to be a doctor. Medical school at UCH, University College, University of Ibadan, and then went back for residency to do OBGYN. I actually wanted to do internal medicine at first, but I guess the lack of, at that time, productivity. I mean, then people were, actually was, for my youth service, I was working in an internal medicine field, and people were sick, and I would diagnose complications. But then, as I diagnosed complications, they were dying, and I wasn't feeling it was result oriented. So then I had to make a switch to something that would be more practical for me, and then I moved into obstetrics and gynecology. So went for my residency in UCH, finished that, and then I was already working in Lagos State government before that. Then I came back to Lagos and started working in Island Maternity here. And over the years, well, you just say move through the phases from being a consultant to becoming the head of department, director of clinical services, and eventually the medical director. Yeah. Okay. So that's in a nutshell how the journey has been.
Amazing. Thank you so much for sharing that, sir.
Okay.
And so what are some of the leadership challenges you have faced since you assumed this role, especially managing a safety net facility like this, which is for women's health, maternal health, and really trickles down to family health?
So, leadership challenges on our the position of being a medical director were actually non-clinical, surprisingly, because, over the years, like I said, I've been here for quite a while. I was one of those who helped to really institute the postgraduate residency training system here. And with that really helped us to solve a lot of the clinical challenges, talking of maternal care, because when the knowledge of the doctors, when it became a training center, I mean, the doctors now had a stake. There was structured training. There was something the doctors were aspiring to, and that caught fire too for the other staff, the nurses, the cleaners and everybody. So there was, it became taking care of patients, became easier because, put in a nutshell, when we started in 2010, our maternal mortality rate here was about 8,000 per 100,000.
Mm.
I mean, then you could have as many as 30 women dying in a month in
Wow.
this hospital, you know. But by the time I took over in 2019 as medical director, and even we were down to about, I think, 30, 50 deaths in a year.
Wow.
In a year, and a maternal mortality ratio of about 1,000 per 100,000. You know, so in fact, when I became medical director, I remember my second or third year, we actually had now just 25 deaths in a month. Sorry, in a year, sorry. And for me, what I was like coming like full circle from when we used to have 30 in a month and we're now having 25 in a year. You know, we showed how things had evolved and things had become, you know, things had improved.
Yeah.
So when you talk of leadership challenges, so that became personnel management, infrastructural management, you know, power management. So they're actually not actually clinical challenges, but you know, other social challenges. I can point them under that umbrella.
Yeah.
So those are the areas where I would say I had some challenges coming in. And I took over in 2019, and the next year, 2020, we had COVID.
Yeah.
So which was another totally different, you know, something new to manage.
Right,
you know,
right.
But I think so that's where strategic planning became very key at putting strategies in place to ensure that services continued, because we had to manage the patients, manage the staff with their own anxieties and fears as well.
That's right. Yeah.
You know, at that point in Lagos, a lot of hospitals actually even shut down. You know, but then Mr. Governor in Lagos even came up with free palliative health care at that point in time. And for us in Island Maternity, we were the ones who had the largest number of patients seen, largest numbers of deliveries and all that during that pandemic, even despite the challenges of the pandemic and all that. So I think we were able to, we even got a recognition from the International Hospitals Federation for our, you know, managing, sustaining healthcare during the COVID pandemic.
Yeah.
So that was a major challenge we were able to overcome. So clinically, we've been able to maintain some kind of steady shape.
Yeah.
You know, but like I said, the challenges have been more with other things like you know, maintaining equipment, getting new equipment, expanding the scope of the services.
Right. And
you
people
know, and then people
and all that.
management too. Yeah.
Wow. Wow, that's amazing. I'm so curious about, how did you do it such that you went from 30 deaths per month to 25 in a year?
Yeah.
What can you tell us exactly what that looks like? Was it something that changed in the infrastructure? Was it better training of the staff? Was it just helping the patients get more educated? What did you do differently that made such a huge impact?
It's a collection of several things, and not just within this hospital, I must say, because there are other things that Lagos State government too also did.
Okay.
And things that also changed generally, you know, the scope. So the first major thing I'll say that happened was when we became a residency training center. So when I came back here 2006 and we noticed these challenges, it was like, they call set of other doctors here. I was like, this is unacceptable. So together we took initiative to say this place must become a training center. Because most of the doctors on ground, their knowledge was deficient, you know, and it just wasn't working. So we did the whole recruitment thing, made it an academic thing, merit-based thing to start a residency training program. So it was merit-based. So we took people who already knew they had that knowledge. And then we started that. So with that, there was more presence on ground. There was better monitoring of patients, better supervision of care, you know, and of course, that improved them things. Because before I'll be on call, any problem, no problem, no problem. Next day you come, 2 or 3 patients died. What happened? So they weren't recognizing problems earlier, but as the head knowledge improved, and of course we be more hands-on. So that started to improve things. Then in terms of patient care, also at that time, for talking about maternal mortality now, things like magnesium sulfate became more available for management of preeclampsia,
Yeah.
and institution of protocols, which is another major thing we did with the residency training program. So that also helped. And then the Society of Gynecology and Obstetrics of Nigeria,
Yeah.
which I was also involved at that time too, also came up with so many training programs too. And Lagos State government through the Health Service Commission
Right.
came up with also a lot of external training programs.
Right.
So in terms of use of protocols, monitoring use of protocols,
Yeah.
you know, and things like that. And then misoprostol also became more available in that time, you know, because these are things I did not really experience in residency, was now experiencing more of. And these are global things that are happening.
Right.
Yeah. So
Right.
misoprostol became more available to for use of managing and preventing postpartum hemorrhage
Right.
and all that. Yeah. And then somewhere around 2015, we developed an ICU here within the hospital. Yeah, so we had the ICU, which was developed with the then deputy governor. There was then deputy governor that has supported us with that.
Yeah.
And with that, so having an ICU, then we now, but for the ICU to work, we had extensive training, which was done again for all the doctors and the nurses who are going to man the
Right. The
ICU.
ICU.
Yeah, we had a whole full 1 week extensive training, brought in facilitators from abroad. And then we had, we now implemented it. And then monitoring. You see, when you don't do reviews, you don't know what is happening.
That's right.
And when you have reviews, you can track and
Identify risk
so
factors.
that was risk factors. So that also helped in, you know, bringing things, bringing down the mortality.
Right.
You know, yeah, because everybody was, and we're on the same, we're on the same boat too. So that really helped us to, you know, to bring things down. So with that, generally automatically, you know, once you have trained staff, committed staff, dedicated staff, then you start, and then I'll start bringing in more equipment too as well. We also started doing laparoscopic surgeries on the gynae side. You understand? So that way, if that's on gynae, you know, and then cervical cancer screening programs, so many of that going on, you know. We are looking at reproductive health as a whole. So all that, you know, just basically helped the hospital to continue to make large strides. In fact, it was in my first year that we had a month of zero mortality. We celebrated it here.
That is amazing.
We celebrated it then. That for once we've had a full month without any mortality in Island Maternity. And since then, intermittently, we've been having those zero mortality months. Every year we always have a zero mortality month. You know? Although we know, I recognize that with the challenges we see, I mean, it's almost inevitable, but you know, at least to get it to that level was very exciting.
That is exciting. Well done, sir. That is such great news to hear.
Thank you.
I mean, in the US, there's still a lot of maternal mortality. California is one of those states where they have high maternal mortality. New York as well, and some of the reasons is there's social issues essentially that are responsible for that. There are resources, there are trained staff and personnel, but social issues which related to socioeconomic status, race, financial capability to pay for healthcare. So we can see that these things are problems, but it's possible to solve, right? And so how can we solve these things in large scale is where we're hoping we can uncover more information, more tools, resources. And one of the things that I noticed you mentioned that stuck out to me was the fact that there were more trained staff members. Even if you increase the infrastructure, increase facilities, it doesn't remove the fact that if you don't have enough trained staff to man those facilities or resources, there's still going to be, you know, high mortality rate. So thank you for sharing that, sir. That is really exciting.
So one more thing I must add is that also expansion of maternal services in Lagos State. That's also very key. Because we can't just say, because with that, at least some problems are solved in other places before, because we are majorly a referral center for badly managed cases. You understand? We're a major referral center in Lagos. If I used to be the last bus stop, that's why we used to have that high mortality rate. But Lagos State expanded her services. They built more mother and child, what they call MCCs, mother and child care centers. You know, I think we built like 7 or 8 spread around Lagos State. So because of that, people don't have to travel all the way here. And then they could see doctors in those places who are also treating them. Some of the interventions I've said, everything apart from residency training was also being done in all these other facilities.
That makes
So that
sense.
also, help to reduce
The mortality.
mortality generally within the Lagos State system.
Got
You
it.
know, and then there's also currently now something that will also help the Lagos State Health Insurance Scheme. So that is also, helping because that provides access and affordability for patients because antenatal care is fully covered. And
Care in the
antenatal care
healthcare?
and delivery, yes, for
Oh,
those
nice.
who are under the Lagos State Health Insurance Scheme.
Okay.
So antenatal care and delivery is fully covered. So that makes it easier too for people to
So the
access
health
that care.
insurance, do consumers pay the government directly for it, or you get it through your job or employer? Like, is it accessible to everyone, and
It's
is it
accessible to
affordable?
everyone. Yes, it's
Okay.
accessible to everyone. It's very affordable. In fact, about 2 months ago, there was an executive order by the governor of
government.
Lagos, that Mr. Governor, that everybody, because it's a compulsory health insurance scheme.
Interesting.
Yes. So enforcement is still a challenge because I'm not sure if everybody in Lagos State knows. So there's still a lot of publicity going into it. Like everybody must have
Health
insurance.
Okay.
So in fact, what we do here is as clients come in, we first of all ask them, do you have health insurance? If they don't have, we encourage them to register,
Okay.
as well for the health insurance scheme. Because with that, that will help to
They
make
can access care.
helps with funding for the healthcare system,
Yeah.
and then of course gives them access to care.
Got
So
it.
for those who have, yes, and for those who don't have, well, some people still don't want to take it up and want to pay. But
Yeah.
we are seeing more uptake in our, patients on the healthcare. But at a point last year, Mr. Governor also just did a free palliative palliative healthcare for all the citizens of Lagos State. Yeah. And with that, our insurance rates here increased by about how many percent? About 200 to 300%.
Wow.
Yeah, increased that drastically at that point in time, and it has been sustained to a certain degree. So that
great.
also is one of the measures Lagos State government is,
Putting in
applying,
place.
yes, to help improve maternal mortality and maternal care.
And the insurance, it doesn't have to be the Lagos State insurance you must have. You can have HMOs from your employer as well, as long as you have any form of insurance. So the one Lagos State is offering is more like an affordable one, like a Medicare for
It's
Lagos State.
also
Okay.
Yes, it's also a social health insurance scheme.
Okay.
So it's also it's quite affordable. In fact, some of us hospitals are still worried about the tariffs because the initiation phase is a bit tricky.
Yeah.
But by the time more people comes on it, it helps with
That's right.
with the funding. So and Lagos State government has been very good in supporting us with that. So it is quite affordable. I think it's just about 60,000 naira for a family of 4.
Oh wow.
Yeah, husband, wife, family of 4, about 60,000. Individual, it's about 8,500 per year.
Per year.
Per year, so it is quite affordable.
That is amazing.
Yeah.
Okay, so we'll definitely amplify that. So more people who are watching and learning about us can know that this is available and they can easily access healthcare through it. Exactly, it's compulsory, so you have to get it. Okay, we've talked a little bit about this, but I would like to say you to say one or two more things about it, which is the current state of maternal care in Nigeria whole, based on your experience. How would you describe the current state across the country, and in what areas do you think we need the most attention?
Well, maternal care in Nigeria, it seems we are stuck because every time you check the maternal mortality figures, if you are going to use that as an index of monitoring, it's almost about the same thing or continues to increase. About 555 per 100,000 is what is for the country.
Yeah.
But if you look generally, it varies from place to place. It tends to be much more worse in the north, in the northeast, and some other areas of Nigeria. Maternal mortality, also hemorrhage. When you're looking at causes of maternal mortality, so you look at the key ones: hemorrhage, eclampsia, infection. Still continue to be a challenge, and the challenge with those I usually have to do with access to healthcare.
Yeah.
So major challenge is still with access to healthcare. Some people don't still have access to quality healthcare.
Right.
So it's not just that you went to a hospital. It's not just that you went to a clinic. What are they able to do there?
Right.
How easy is it for you to get there? Those are the challenges that we are still seeing, especially in the rural areas, and even sometimes more now in the urban areas, because where you have not well regulated healthcare providers too, which tend to be a problem. And just like you said, in the US, that becomes economic because people feel they can't afford a
Healthcare.
good private hospital or a good public hospital. And if they know that there's this insurance which makes it easy for them, that's good.
Right.
And that could solve part of the problem. There's also the issue of we're also talking about, yes, access. Well, we've already touched on affordability too being one of the
Right.
major challenges.
Factors.
But with the health insurance, which is under something is under the recent National Health Act, it was also that everybody should have insurance, and it's the culture and the mindset that has not really gotten to people, more so
Yeah.
within the informal sector.
Yeah.
Because once you have that, it really is going to help to bridge the gap.
That's right.
Yeah. Well, still from that angle, there's also the issue of, will I say, cultural factors, you understand, which are still causing some hindrances in some environments, poor uptake of family planning, and things like that, and decision making in homes, as in before a woman decides to go to a hospital, has to see the husband and all that, and things like that. Another major challenge, apart from this access and affordability, is manpower. So with the brain drain, which really hit us hard over the last 4 years or so, and it's still ongoing. So human resources for health, and not just doctors, nurses, even pharmacists, so that has created a lot of challenges for a huge gap for healthcare. I mean, the ratios are crazy. I mean, from what WHO says to
I hear Nigeria is the largest exporter of talent in the world, especially healthcare.
So the doctors who are on ground are not well spread. And they are still overworked in terms of number of patients they see, and that affects quality of healthcare that they can get, and affects access for even people who are going to receive this care. So the human resources thing, the access for people to, I think those are some of the two major factors that we have, because I mean, there are not enough doctors, and then of course there's also the number of trained doctors. And I'm talking about specialists as well, because a lot of specialist services have also been hard hit by this brain drain. You understand? Even some of the teaching hospitals now, there are spaces for training which are not even being taken up. You hear about just maybe 2 residents in the whole of internal medicine in a teaching hospital. So that's also a dearth of knowledge
in internal medicine.
Yes, I think I heard something like that in one of the teaching hospitals. I won't mention names. So that creates
concerning.
a problem. It's a concerning. It's a big concern. So even the doctors are on ground. What is the knowledge base? What is the training? And where some of them are just itching to go abroad to, so it creates those are things that are creating big vacuums for us in our healthcare here. And it's quite a challenge. Just earlier on today, we were talking about how we don't have so many histopathologists again within Lagos State healthcare system.
So diagnosis becomes even a
problem. Yes. Also radio diagnosis too.
That's right.
That's another challenge where we're having manpower issues. So it's the manpower issue is huge. And it's worsening something that was already a challenge, where you are talking about access. Now there are no even people to spread to give that access to.
Wow. Those are really, really concerning thoughts. And to be honest, even though we know these problems exist, we still feel like many of the doctors who are leaving or who have left, they don't have, even if they want to come back, they don't feel like they have what it takes to really integrate themselves back in the system, because they've now seen how things work over there. How do I come back to doing, like surgeries without even having a histopathologist available or radiology and all of that? So question is, how do we empower patients? Like, what role does patient-centered care play in your practice or in this hospital? How has the hospital or Lagos State empowered patients on their own to improve their own outcomes, and how has it impacted really the outcomes that you shared with us earlier? Is there any role that plays at all?
So patient-centered care, we had a whole, there's time we used to have monthly themes in this hospital where we take something and try and educate our staff on it. And there was a time, I think last year or 2 years ago, we did something on, we had a whole monthly team on patient-centered care, which basically is involving the patients and the relatives, in their care. I'll say it has a positive role, no doubt about it, because the more enlightened people are, then
That's right.
they are carried along, they are more likely to accept what treatment you want to give them and all that. So gone are the days, well, for here where you hear people rejecting CS. I reject it in Jesus' name. So, and things like that are gone now.
Yeah.
Because we do a lot of health education where we carry them along, That one of the innovations COVID brought for us, because when COVID came, we couldn't do our health talks the way we used to do it. So we set up this WhatsApp group for our patients. So there's a lot of education going there, training. I know it's easier to get people to read their phones and even to sit down and listen to.
That's right. It's true.
So that
true.
also really helped, with the educating the patients and getting their buy-in into understanding, how things are done here and how things are relevant to their care. I know at that time too, on our website we even tried to put information pages where people could go and read and get information. So getting highly informed patients and their relatives really helped. And we try to promote that here as much as possible. So we have this birth preparedness thing we do by the time one gets to term. We are discussing planning their delivery with them.
Right.
You understand? So what is it that you want? What are your expectations?
Right.
You understand? Or from your case, this is what you see is going to happen. Do you have any questions, any concerns? So getting their buy-in and all that. And we get very little resistance from patients. It's such that a lot of, very well, that has been consistent. Over 90% of our mortalities, when we do have mortalities, are from patients who are not registered here.
Oh, I see.
So then we still have some coming from traditional birth attendants.
Yeah.
Some coming from other hospitals who are not qualified. Some who never went to a hospital during their antenatal care. But for those who actually come in here,
the outcomes are way better.
And the patient satisfaction has largely improved. We do quarterly patient satisfaction surveys where we try to get feedback from the patients, on the care that they received.
Yeah.
And overall, yes, of course, they always have some complaints, but overall, they're always largely satisfied.
Yeah.
And they always say they will recommend the hospital to somebody else, who tells us that at least we are doing something right.
Right,
yeah.
right.
And we think it's the patient-centered care approach is one of the things we think that is really, helping with that.
That is great. I love that, because you can't beat the patient empowerment piece when it comes to healthcare. Because at the end of the day, you do your work here in the hospital, but then the patient goes home. You don't know if they'll take their medication. You don't know if they understood everything you discussed with them. You don't know if they would even come back for a follow-up. So for you to have been able to walk them through that journey to get from point A to B and trust the process to have that better outcome, that is a great deal, especially in Nigeria, where we know that the health-seeking behavior of people are quite, concerning, in the sense that, like you said, some women have to ask their husband for permission to even go out to go get healthcare. Some of them don't have insurance. Some of them don't even have money for drugs to pay for some of the things they're supposed to be doing. So I'm really excited to hear that the patient-centered care has taken up, and it looks like COVID kind of activated an increase in the uptake of technology and healthcare infrastructure that helps to increase that access through patient education and advocacy. So that leads me to the next question, and our last question before I ask you to tell us a story is, how do you see technology changing the landscape of maternal health care in Nigeria? Are there any digital innovations or tools that have made a significant impact at this hospital? And how have you been using it and leveraging it to show some of these outcomes that you are experiencing?
Yeah, so technology, you can't run away from technology in this era. I mean, it's something that plays a big role, and you just have to know how to use it to get the best of it. And it starts from the simplest things in terms of improving diagnosis, in terms of patient care, and things like that. I remember in 2003 when I did an observership in the US, and the consultant there was using a handheld Doppler to listen to the fetal heart, and he was asking me if we still use the peanut fetoscope here, and at that time, yes, we did,
Yeah.
and yes, because it's simple and
Yeah.
what do you call it to use and all that. And even here, it was still something that was still in use for a long time for one or two several reasons. Well, what do you call it? Using things that are, I've forgotten there's a word for it now. Um, Things related to your environment, you understand?
Local.
Local and all that.
Yeah.
I can't remember if I remember actually.
Okay.
So, but during COVID, we just had to step it up.
Yeah.
Because minimize contact as much as possible. So handheld Dopplers.
Yeah.
That's what we came up with. CTGs were reserved for very difficult cases and everything. During COVID, we went and got CTGs for everybody because we wanted to minimize, contact with patients. So, like I said, simple things like that. And then, of course, have an ultrasound scan in the labor ward, in the emergency room, making sure and then training doctors to know how to, because you could have those, and if you don't have people who know how to use them, it's a problem. So train the doctors for basic ultrasound, that will just to make simple diagnosis that can help with decision making, So there was that. Still keeping it simple, and also going back to COVID. Phones, like I said, the WhatsApp groups, became more useful for engaging patients. We opened up phone lines where patients could call the hospital when they had problems or challenges, because we didn't want people coming in unnecessarily.
Right.
So doctors on call were assigned the phone. So you call the doctor, you can talk to the doctor, you can let you know whether you should come or just deal with your challenge, there and then. So those are one of the other things where technology also helped. We got our Zoom platform. Been paying for Zoom every year since then. So a lot of our trainings are done by Zoom now. So there's a morning review we do every morning where we discuss all the cases admitted the day before. That is done via Zoom now. So
Still
everybody
today.
can plug in. Yeah, still today.
That's great.
So that's technology helping, one way or the other day for even our trainings and all that too. So that there's one year where we had our annual staff party through Zoom. It was in that COVID, that started in 2020, 2021. When the raffle draw, everything was done through Zoom.
Wow.
But the hospital was kind of abuzz with it.
Yeah.
So those are simple ways that, technology, has been able to help us. And about 3 years ago, was it 2 or 3 years ago now, we also adopted electronic medical
Record
records.
keeping. Yes.
Yeah, we started it here. That's also in my time. So that also transformed everything, from carrying of case. So it was a constant problem. Patients' case files are getting missing, can't get medical records. When you get them, can't even read the doctor's writing. I mean, I haven't written anything for you. You don't need to see my writing. So there are all those, challenges, you understand. Doing research was very tricky because our resident doctors needed to do research and all that. So EMR has changed that for us completely. And it was also exciting because even for, some of our staff who are not even really computer savvy, having to learn it and use it. So now all the nurses on the ward use it, all the doctors use it, and it makes things move faster. Investigation results now, all you do is get the sample to the lab. You don't have to go back and wait for the result in the lab. It's sent back, directly to the ward. So that reduces patient relative traffic moving up and down. So technology has really, really, been very helpful for us in that, in that regard here in Island Maternity. And we are looking to see how much more we can use it. Just a simple one, because it starts from the simple things. So now what I started with them is that, we're always doing all these things. We are celebrating Safety Week, Sexual and Domestic Violence Week. And so I said, now we must conduct surveys.
Okay.
We must conduct surveys for all these things, So Google Forms are done, which are used to, conduct these surveys. So, survey. What questions are we going to ask? I said, just go to Meta on your WhatsApp. Meta, do up a survey for
That's AI.
sexual. That's AI. Yes,
That's
that's
amazing.
AI.
Yeah.
So no, so I said, so you take that and I now develop it. So I've
Yes.
had to teach my staff that
How to use
over these last 2
AI.
months. Yeah, that's how to use AI. And they're using it
Yes.
well, that sort of thing. So
That's great.
thank you. This is easy, and they
Yeah.
now can modify it and adopt it and
Yeah.
everything. So and looking into what more ways can we. So that's the beginning of us using AI here in
Mm-hmm.
Island Maternity,
Mm-hmm.
because this is 2 months. This is just 2 months ago that
Wow.
and I was just here. And then I want you to do a survey. How are we going
Mm-hmm.
to do that? Okay. Ask Meta. That's AI. So, and that's the beginning of it.
Yeah.
So we'll be looking into what other ways we can
Do
also
so much
adopt
more.
AI to help us,
Yes.
here in providing quality care for our patients.
Wow, that is great. You're such a forward thinking,
Mhm.
innovative, and curious leader. And we really appreciate what you're doing because
Yeah.
essentially, you being the head of this hospital has saved so many lives. I mean, your numbers are just mind blowing from, the monthly mortality rates down to yearly. It's impressive. So God bless you, sir. Thank you for
Thank
the
you.
work you're doing.
Thank
One
you.
last thing I would like to ask of you, which was not on the list, was I would like for you to tell us an inspiring story, a story that you remember that keeps you going through your journey as a medical doctor or leader of this hospital.
Stories. I think I should just give you my book.
Yeah, which I know there's quite a few of stories in that book.
Well, the let me try and just think now which stories. I have too many stories to tell. And I'd like to make down. I'd like to tell two stories. I'd like to make that the second one. Let me just start with that.
Yeah, you can do as many stories as you
The
want,
first
actually.
one that really struck me was as a house officer, which was also in this system. Um, so there was this young girl that was brought. She had tetanus, and she was out. So spasm, spasm, spasm. So we had to keep on sedating her. Knock her off. So and it was scary to me because she was so young. And I think she was 14 or so, 13 or 14. And she was somebody's house help or something like that. So low socioeconomic class and all that. And having these recurrent spasms. So as a young house officer, then I was like, nothing must happen to this girl. And I was very on her case. And she started to come out of it. And then one day I get to her bedside and she's fully awake. I said, doctor. So she calls me, doctor, what happened to me? Okay, this is what happened to you, but you're well now and everything. Okay. And I left her bedside. She calls me back again, doctor, when am I going home? Don't worry, you'll soon go home. Okay. And I leave her bedside. She calls me back again, doctor, am I going to be okay? Like, I need to get to other patients. And I said, don't worry, you'll be okay. And I leave and I went, doctor. And that time I was almost going to
Like,
put a
shut her
ceiling on
down.
it. And she just says, God bless you. And that when I realized what medicine was about, because there was a feeling that came with that God bless you. It was like, this is the currency this is the real currency of medicine.
Yeah.
For this young girl to appreciate what you have done and, to be alive, she was literally gone before she came in. And for her to be able to tell me, that God bless you, was, it was quite fascinating. It was
And
quite
touching.
fascinating and quite, it was quite touching, Another story I could tell was which one do I want to tell now? Maybe I just leave it at that. There are just too many stories. There are too many stories of patients who have yes, there have been some sad stories, there have been some, good stories, some divinely inspired stories. Because I was just telling somebody one about one that happened today. That happened some years ago. There was this lady who had these lesions all over her body. So she was to be operated, have a cesarean for that reason, because of the lesions.
Yeah.
And there are two cases scheduled for that day, that morning, I remember. One was a member of staff, one was that patient. And normally I would say do staff second. But that one I said, let's do this patient. But that day, the nurses, bulldoze their nurse in first. And I didn't resist. Normally I would resist, but I did it. So I did this lady second. While we were doing her, they couldn't intubate because she had a
Lesion.
lesion in her throat, which she had complained about during the pregnancy. And I told her to see an ENT and said after the pregnancy. So they did it with a mask, monitored her after she was fine, even checked monitor in the ICU for like 30 minutes or so after she was fine, moved her up. And I went about my business and I was called that she was gasping. How can she be gasping? You know? So went back. As I got back there, she was already in theater. And luckily for us, the ENT surgeon happened to be around at that point in time. So that wasn't in this hospital. But the ENT surgeon, he runs his clinic in the afternoons on that day. So he happened to be in the hospital at that time. And because of that, he was able to put in a tracheostomy tube. You understand? Which saved her.
Oh, wow.
That was literally what saved her life. Because any other thing through mask would have not worked. So it was like, if I had done that surgery earlier in the day, you might have lost her. You know, and that's one of the challenges of healthcare here, when you can't have everything you want at every time. You know, so sometimes you just need some
divine intervention.
You know, and that's why we pray a lot here. So it's still necessary, but by the grace of God, we'll get to the point where, you know, we'll be able to have, you know, all what we need. For Island Maternity, we say our vision is to evolve into a world-class tertiary hospital. Yesterday, some of my staff were in St. Nicholas. 2 months ago, they were in Evercare. Last month, they were in FMC Butimeta. So go and visit all these places. Go and see what they are doing there. Bring back ideas. So our management meeting yesterday, we were looking at all the recommendations brought by staff based on what they saw in other hospitals and looking at how we are going to implement them here. Because it's little things. It doesn't always have to be this big, grandiose buildings and stuff, which nobody may occupy again, you understand? So this is what we are doing. Let's do it and let's do it well.
Thank you so much, sir. And I do pray and hope that God will indeed grant you that vision to be a world-class tertiary institution. And may God continue to empower you to, you know, deliver people and deliver babies and give them new chances at life, you know, with better health outcomes for maternal health. Thank you so much, everyone, for watching. This is Dr. Omololu, CEO of Island Maternity Hospital. We thank you so much, sir, for giving us the opportunity to speak with you. We will be in touch and give you more reasons to do what you're doing. Hopefully, by God's grace, we'll be able to contribute to some of your efforts here in the hospital.
Thank you very much. It's been a pleasure talking, and always like any opportunity to educate and inform people so they can stay healthy.
Yeah.
Thank you.
Thank you.